So I see the record buttons on there, so I'm assuming we're ready to go. So welcome everyone to our second webinar of 2021. It's good to be back again with everyone. It seemed like this week was the month of January is a lot of historically Black fraternities and organizations founding day. So, I went ahead and broke out the Kappa Alpha Psi. I'm doing it for me and my boss, Gary Puckrein. And I guess I got to give Brandon Webb a shout out and everyone else too. And especially the women today being Alpha Kappa Alpha Day. My grandma, shouts out to her. But it's just good to have these three people leading a conversation today. As you know, more than anything, these are the three closest people to me. We always have future Dr. Mia Keeys, and then we have Dr. Congresswoman Robin Kelly, who was my forever boss / mom, and then Dr. Gary Puckrein with NMQF. So without further ado, I just kind of wanted to talk about what they have planned for this already busy, crazy, and hectic year. So Mia, I'm turning it over to you.
Thank you, Brandon. And of course, NMQF, thank you so much. Certainly want to give an extended shout out to the ladies of Delta Sigma Theta Sorority Incorporated, since we celebrated our Founders Day just 2 days ago. And of course, we have to give grace and homage to the ladies of Alpha Kappa Alpha, as Brandon mentioned, as today is their Founders Day. Our Vice President-elect is herself a member of Alpha Kappa Alpha. So excited for that. And we have a lot to talk about today, especially given that we are coming off of a week of several Founders Days, and all of our organizations to a great extent has been founded on civil service, and the ideas of really taking care of our nation by also taking care of those who are consistently marginalized and minoritized, and the beautiful thing about what we stand for is that we're able to really live that out through our work, right? So in the spirit of sisterhood and togetherness, as well as service, I want to first and foremost check in with Congresswoman Kelly and with Gary and with Dr. Puckrein. How are you both? This has been quite a year that we had, and on top of all of that, it's been a crazy 15 days of 2021. So Congresswoman, I'll start with you.
Well, first I'd like to thank you guys for inviting me again. It's always great to be with all of you. I want to extend Happy Founders Day to the women of Alpha Kappa Alpha and Delta Sigma Theta. Brandon left out that his mom is a Sigma Gamma Rho. And I know Zeta Phi Beta has a Founders Day coming up and the end of their centennial. So Happy Founders Day to everyone. My 3 words, I'm hanging in there, but I just heard someone say I'm somewhere between O and K. It was an unbelievable week. As I shared earlier, I was one of the people trapped in the gallery, waiting for the Capitol Police to tell us it was okay, to run. And that's what we did. We went from one side of the gallery to another, and we were on our hands and knees. It was about 30 of us. And, I'm big in the gun violence prevention space. And I just said to myself, wow, is this the way it's going to be? I didn't say, is this the way I'm going to die? Because I couldn't let myself think like that. But that did, go through my mind. And it was just like, wow, am I in Congress, going through this? Finally, there were 3 taps at the door. It was the Capitol Police, and we ran downstairs through hallways to go to an undisclosed, location. But I'm still, depending on who I talk to or when, I still could be a little teary, but I'm frustrated. I am angry, even though I don't want to hold on to the anger. But it's frustrating that people put us through this, the President of the United States and some of my colleagues. And I hope that they get in trouble, because they deserve to get in trouble. And, we lost 5 people, and then another police officer to suicide. It was a tragic day that should have been a great day for Democrats with Georgia coming through.
Congresswoman, on a personal level, I'm so grateful that you are okay, and in the sense that you're here, right? And I acknowledge that there's a lot that you may not have time or wherewithal to share with us on the call, but what you've shared, completely grateful for you being transparent. I was blowing your phone up, trying to figure out where are you?
You and, like I said, I feel quite loved because many people, many of my, friends, family, my sorority put out a national statement that I was okay. I didn't even think about it. And then the mayor of Chicago said, a lot of people are worried about you. You need to say, I'm okay. So that's when it finally dawned on me, to do it. But people, our chests were heavy, our hearts were heavy. And then we were in a room with colleagues that didn't think it was important to have masks on. So as a result of that, there's at least 4 more people that have COVID.
Yeah, we're gonna dig into that as well, because on that day, what also happened, I think we had at least 4,000 people either succumb to COVID or were hospitalizations were just completely out the roof. So we need to talk about that whole entire confluence. So yeah, I'm going to put a big pin in that, and let's come back to that.
Okay.
Dr. Puckrein, same thing. How are you?
I'm doing okay. I heard you say last year. I feel like I've lived a year already. I think January has been a year. It's kind of amazing all that has occurred in this space. First of all, I want to say to the Congresswoman, we're so pleased for your service and glad you were safe. None of us could imagine that when we sent you to Congress, we were also putting you in harm's way. That's a crazy thought. And it says something that is deeply unsettling about our country right now that we all need to think about and work on very, very hard. So anyway, we're all very, very thankful that you and your colleagues are safe. I want to also shout out to Founders Day. I did get the memo. I forgot the memo, but for my Kappa brothers, I'm there. I get it. Brandon did come in and remind me, and I forgot the memo. So anyway, the word that I've been thinking about the last couple of days, that this event on the Hill suggested, and George Floyd and all of the other events that have been happening really over the last year that people don't talk about enough is the word safe. Do African Americans feel safe in their own country? I don't think people understand how dangerous it is African Americans feel in this country. That going into a healthcare system could be a life-threatening event just because of the way in which people feel and think about you. If you look at the people who were assaulting Congress last week, those were professional people, right? We're not talking about people who didn't have degrees, were police officers, were state legislators, were people in business. And in our everyday life as an African American, we interface with them and we don't know who they are. I mean, they ripped off the mask when they went up on the Hill, but in everyday life, those are the folks that we associate with. And that level of safety is really, it just can't go on. And it's spilling over now, so that it's making it dangerous for other people. And we've made a lot of decisions that have created that sense of unsafety. Like, we're the only country in the world where we think everybody should walk around with a gun, for God's sake. I mean, part of the whole idea of the social contract is that you come out of the state of nature, that you don't have to walk around with a gun. So anyway, I think there's just a lot of, really, we have to have a fundamental conversation, and we need to, we're all going to have to work very, very hard in order to bring us all to a safe place. So that's sort of my sort of sense.
Yeah, and I deeply appreciate you offering that, Dr. Puckrein. And I want to make a parallel or extend that thought on the word safe and safety. You know, when we talk about vigilance, right, to unsafe contexts or to threats, right, that constant vigilance that you, Congresswoman Kelly, that you felt, right, and consistently feel in various situations. And, you know, there's all kinds of research that demonstrates that an extended sense of heightened awareness and vigilance does matter with respect to the way that stress plays out on our body. And when we're talking about people of color and specifically people who are Black and Brown, we're also talking about, you know, the impact on chronic disease, right? Because of stress. You know, the American Medical Association just recently, over the last year, passed really legacy historic policy around claiming racism as a public health threat, right? And also another policy decrying or emphasizing that race itself is a social construct with major biological consequences. And you know, there's research that demonstrates even with Black men who feel consistent stress on their bodies, their actual telomeres, the parts of our body that have to do with aging, they're shortened as a result of stress, right? And just that impact on the body, on the spirit, on the mind, all of that plays into how we approach our work, how we interact with others, and it's heavy, you know. And so I want to talk about, you know, really how is it that racism makes us sick? And I'm using that term because also, Dr. Puckrein, you have some things coming up. I'm pretty sure you'll tell us about the annual summit for NMQF, you know, but let's talk about that.
Yeah, you know, African Americans have the highest level of hypertension in the world. There's no group of people in the world that have hypertension like African Americans. I think the number is somewhere around 67% of all African Americans have hypertension. They become hypertensive in their 40s. And I'm sure it's related to the everyday stress that occurs. When I first started working on health disparities, this was in the late 1990s, it was often talked about the failure of African Americans to be mindful of their health, to be non-adherent on medications and all that stuff. And it was a blame the victim scenario, right? Because until we had Obamacare, 48% of African Americans had no health insurance. Could you imagine having diabetes, cancer, sickle cell, whatever you got, and you have no health insurance? And everybody knows the first thing you go into a healthcare system, the first thing they ask you is, tell me what insurance you got, because that's going to tell me what exactly I can provide you with. And even as we've gotten that health insurance, now we have to battle for it because folks don't think that their neighbors, and particularly African Americans, should have health care. We've worked with a lot of patient advocacy groups and organized medicine and even businesses that in the light of George Floyd have talked about healthcare equity and wanting to make a contribution. And you know what we have to remind them at the beginning was that the current healthcare system was built during an era of segregation, when it was perfectly all right by law and practice to not provide quality care for African Americans. And African Americans couldn't go to certain hospitals, certain physicians' offices, and actually the society didn't even care, you know, what health care they received. That legacy system is still there, it's still operating. And when African Americans come into that system, they're still challenged by that. And so one of the things, and this is why members like Congresswoman Kelly, who is so focused on healthcare, are so profoundly important, because we do have to get the legislation and the policy right before we go. And there's somewhere down the road, and I'm not sure exactly how we do it, we have to challenge those who want to maintain that segregated, racist society, that they're willing to put the lives of others in danger to maintain. So I think that's the conversation for the moment. That when I was growing up, talking about race was not well thought of. You didn't talk about race in the public domain because it made people uncomfortable. And so, with your white friends, you didn't want to raise that issue. I think we have to raise it. I don't think we have a choice. We have to drag this thing out into the open and have a national conversation, and then try to figure out what can we do about it.
I couldn't agree with Dr. Puckrein more. And when I just think about in the Chicagoland area, that you can go 7 to 8 miles, and depending on which direction you go in, your life expectancy increases or it decreases. And when you leave the community of color, of course, it increases and go to the north side. But when you go from north to south, and it's a 30-year difference, that is absolutely ridiculous. And I'm sure the Chicagoland area is not the only area like that. On top of it, something I've worked very closely with me and Keeys, looking at women having babies. Now, too many women, period, die, but why is it that Black women die 3 to 4 times the rate of white women? In Chicago, 6 to 1 time the rate. Native women die 8 to 1 times the rate. In the state of Washington, Dr. Puckrein talked about high blood pressure. Of the top 10 diseases that Americans die from, we're number 1 in 8 of the 10. So something's going on somewhere. And the other part of it is we need to have more people of color, more African Americans, specifically in the healthcare field. Everybody doesn't have to be a doctor, an MD doctor. Everyone doesn't have to be a nurse. There's plenty of positions like you and Dr. Puckrein, have, or Brandon Garrett has, to see us through, to make policy changes, to educate people. We have to make changes, and we have to make changes in how we train people when they do go through nursing school or medical school or whatever school they have to go through for their particular profession.
So many things to your point, Congresswoman Kelly, to really elevate in the policy realm, right? So you've mentioned so many things having to do with workforce, with training, with respect to not training just within traditional clinical settings, but within policy settings and around advocacy. These are skills and skill building techniques that a lot of times are not valued in the traditional medical care system, right? But we need them, right? And clearly the events of last week demonstrate that, And I think a lot of times we and our audiences are very practiced with talking about the role of race and racism as it impacts Black and Brown people, right? I want to ask you both, with respect to whiteness and people who are white and people who are not Black, who are not African, who are not Indian American, or so on and so forth, Latin members of the Latinx community. How does racism impact that? Where's the conversation of whiteness within policy settings? How does that show up? And Dr. Puckrein, you were talking earlier about how, it was taboo to talk about race. How has that conversation changed now? And how does racism impact whiteness in your spheres of influence?
So let me answer your question this way. I think the first thing we all have to say is America is a multicultural democracy. We don't say that loud enough, but it is a multicultural democracy. And that means that everybody gets a vote, everybody gets to participate in it. And in response to your question, I'm going to talk about what we're thinking about in terms of legislation and policy and things that we need to do, not just to talk about the past, but to talk about, okay, so where do we go from here? So fundamental principle that we operate from is that everybody who comes into the American healthcare system, whatever their skin color, sexual orientation, age, whatever it is, the objective of the system is to lower their risk for hospitalization, emergency room visits, disability, mortality. It's not in the business of elevating their risk. And I say that because when you think about health disparities, what you're really talking about is a system elevating patients' risk and not taking care of them so that the mortality that Congresswoman Kelly described occurs. So along those lines, I think you have to start at the beginning. We need good data. And I think we have to have a data system that we minorities feel comfortable with, right? This is not a data system that's generated by the government, because we've already seen that with COVID, that government will hide the data when it gets ready to. And we've got different forms of government out there, at least different opinions about government. So we have to start building systems that measure the quality of care that's being driven in our community. Because the point is, the outcomes are measurable. We can see the disparities, and in that, we can direct our community where they can go get good health care, et cetera, et cetera. So I think that's important. On the clinical trial side, what we've seen that's worked in clinical trials, it's called market exclusivity. So we didn't have good data on the pediatric population because nobody wanted to do clinical trials on children. And so the pediatricians got together and they created a rule called the Pediatric Exclusivity Provision. And what it did was it encouraged innovation in at least testing of medications in children by giving some market exclusivity, meaning extending patents a little. I think it was 6 months if you did a trial in children. Worked very, very well. We've got a whole set of medications now for children. We had trouble with rare diseases. We weren't studying, we weren't creating for like sickle cell. And so we came up with a market exclusivity. It was called the Orphan Drug Act, right? And the Orphan Drug Act was passed. And now most of the new medications that are coming out are around orphan drugs. I think we need to do something like that for the underserved community, not just African American or Hispanics, but underserved in the sense of we don't have enough science, information, therapies for them. I think if Congress put something like that together, it would do wonders, and we would get more science on minority populations because we don't have good science on it. And then finally, I think the hard work is we actually need to reimagine HHS, right? In the Pentagon, they wake up one day and say, I need a new tank. I need a new airplane. I need something new because of the threat that I see. HHS isn't doing that. It's not waking up in the morning and saying, oh my God, I see a threat to the American public and we need to take care of that threat. We need to organize everything. That's why we got this COVID mess, right? Because we kind of knew pandemics were lurking out there, but we didn't organize ourselves to do it. So I think it's time to reimagine HHS for the 21st century. And I think if we start down those pathways, I think we'll come out the other side pretty well.
I wanted to pick up on Dr. Puckrein mentioning data. One of the problems is data is not even collected in the same way nationally. That's what we found with COVID-19. People weren't collecting data on race and who got it and age and all of those kind of things. We were able to get in a piece of our legislation so that the CDC would have to start doing that. But the problem is state by state, some states don't have, they have two different ways they collect data in the same state, and or some just ask for maybe race and age, and some ask for other things. So we have to have, a national way to collect data in the same way so that we have the information. And then we have to make sure, which we had in the legislation, that they give reports about, what is going on. Some places have done it better than others. That's how we know, about Chicago and Illinois and some other places, because they do a much better job and they weren't trying to hide what they were doing, and so I think that's extremely important. The other thing, when we talk about where do we go from here, and if I'm jumping, stop me. of course, we know we have to make sure that the vaccine is distributed in a equitable way. But before we can do that, we have to make sure our people are open to taking the vaccine. There's a lot of vaccine hesitancy, even in the healthcare field. You know, we've heard about healthcare folks that don't want to take the vaccine either. But you know, it's very, very important that we get the word out. And you know, I was told it can't just be sweeping things, that, you know, we have to speak to people in small groups so we can answer their questions. We can, you know, bring them comfort, and it has to be people they're comfortable around, speaking with them, you know, about it. Community ambassadors, leaders, healthcare professionals, whatever is a comfort to those folks. So that's something that my office is going to be working very closely on. And the other thing also is, of course, we're continuing our work with maternal health, but also health IT and telehealth. Because of COVID, that just blew up. But also, we also know my district is urban, suburban, and rural, that some people can't even get online because they don't have the broadband capacity. So that hurts as far as telemedicine, it hurts as far as e-learning. So those are things that, you know, we're definitely going to be, you know, refiling and pushing for in this 117th Congress. But we have to keep educating our people about, you know, not only COVID, but, you know, just healthcare in general. We have a lot of work to do.
You know, we are going to talk about next steps. And before we do that, more deeply, Congresswoman, and thank you for introducing that. I want us to back up and talk about 2020 a bit, right? So between the three of us and really everyone on the call, I imagine we can all argue until we're blue in the face that what happened last year in terms of the confluence of inequitable care and treatment with respect to COVID-19 and racial violence, social unrest and tensions, none of that was new, right? We know that, but together it really just blew up, you know, the national conversations in a different way, where such that dominant narrative around what the US stands for is being contested within national platforms in a different way, in a way that we've not necessarily seen before, you know. And so I want to know, between the two of you, what were major takeaways, right, and lessons from 2020, both within the healthcare sector, within the political and policy sectors, and how does last year and moving into this year change some of what stories we tell ourselves in terms of what America stands for?
Well, I mean, I think that between COVID and, I'm just saying, George Floyd, I know there were many, Breonna Taylor, many other people, it really put a spotlight on how Black lives don't matter. And I mean, that's the thing that just rings over. Even for me as a Black person, I even got a deeper understanding about Black lives mattering, you know? I mean, it was just so unbelievable. I've used that word so much during the Trump administration, what was happening. And even now, you know, things have continued to happen. Like, what are people thinking? But we have so much more work to do, and how important it is for us to, you know, be at the table, or, you know, as some have said, change the table, that, you know, so that it makes more sense for all of us. Where I heard someone say,
Jesus would just flip the table over in the temple.
Yeah, I've heard, you know, yes, we're all in this together, you know, COVID, and we're all in this together. We're all going through the storm, but we're going through it in different boats. You know, that, you know, some have yachts, some have canoes, some are rowing, some of us on a raft, and we have got to, you know, be bold, be brave, and step up and make the changes, and not, as my dear departed colleague, you know, when you see something wrong, don't be afraid, you know, to stand up, speak out, and get into necessary trouble and good trouble. And we need a whole lot of that. And I just think that I'm hoping Joe Biden can restore some of the ways that we are looked at globally, because people can't believe it. I'm on different committees and I talk to people from around the world and they're like, what the heck is going on? And then we've always been, so you need to do it like us. And now, I don't think we can say that as much.
We certainly couldn't say it with respect to maternal health. We couldn't say it with respect to hypertension. We can't say it in terms of how we welcome people into the country. And I can,
in many ways,
litany.
Gun violence, violence against women, many, many ways.
Mm-hmm. Dr. Puckrein, you look like you're going to jump in here.
Yeah, I think the most important thing that I understood and thought a lot about COVID, the response to COVID, the Trump administration response to COVID, and some of the language that came out. So I think I would summarize the Trump response to COVID as our biology should support our economy, that the economic order needs to be preserved, and 300, 400, 500, 1 million people die, that's okay. If you remember the lieutenant governor of Texas saying that, if you're 75 years old and you have to die in order to protect the economic order, that's okay, right? And part of what got us into the soup is that the Trump administration rushed to open up the economy early because they wanted to preserve that economic order, the restaurants and all the other stuff. What they didn't think about, and what wasn't important to them, is that our economy should support our biology, right? That we have to flip it, that our economy needs to be in support of our biology. And that's really what its function is. And because we didn't get that right, people are afraid to travel, people are afraid to go to work, kids are not in school, because we didn't understand that basic principle. I think the most important answer to that is really deep in the African American experience, right? Our bodies have been sacrificed to the economic order from the moment we got here. I mean, that's been what the African American experience is about. And I think what we have to say, the lessons we have to bring to the larger community, is that you can have a great society that is built to support our biology, be it climate change or healthcare or whatever you want to think about. And that's really our future. We have to kind of rethink how we are organizing our communities, because you can't have a community. I was looking at some data from CBC and I was stunned. We have communities where life expectancy from birth is 60 years old. And the other thing I would point out, because I think it's important that sometimes we miss, there are a large number of African Americans who reside in Republican districts. All those guys that are running around there denying the election and all that stuff that they're doing, some of their constituents, and not a minor part of them, are African American, and they're supposed to be arguing for them. They're supposed to be making sure that they have health care and jobs and education and whatever. How would you like to live in one of those districts? How would you like to feel safe in one of those doggone districts? And that's my point, right? That they don't even want to take care of their own constituents. And so I think, this is why this conversation is so very important, that we shouldn't lose the moment that COVID has brought to us, to think about the society in which we live in and how we want to organize it.
Well, hopefully this isn't just a moment, right? So to your point about reimagining, this needs to be the pivotal, the crux that catapults us into a reimagined 21st century.
This is the crucible.
This is the crucible.
Yes, it
is. You often talk about, and for those who are on the call who don't know, Dr. Puckrein, you're an historian, right? And you and I have had conversations about at the top of the 20th century, end of the 19th century, one of the greatest minds within our country, Du Bois, William Edward Burghardt Du Bois was talking about the problem of the 20th century is the color line, right? And you and I have had conversations reaffirming that the problem of the 21st century is the color line. And in so many ways, and I know Congresswoman Kelly, you see this all the time, we have these voices, in our most heralded institutions saying we are beyond the point of having to discuss race and racism, right? This whole, ridiculousness about post-racial society. But last week, this time brings us back to, needing the words of Du Bois and having to really grapple with the fact that, no, we are not beyond it. We've been sweeping, and we've been cowering, we've been completely unpracticed and staunchly so, with not grappling with these issues, that have to do with something so very, it's not easy. It's not easy, but it's who we are, and we can't shy away from that. Like I completely push against narratives that say America is not all of these disparaging things that clearly we are, and not because this is what we aspire to be, it's because we've not collectively decided, well, this is my task in moving this needle forward. I'm going to step into it, right? And I'm speaking especially about liberal people who are white that have a political agenda that, on the surface says we love everybody, but what they're saying is, I don't see color, we love everybody irrespective of. And that's not the conversation we need to be having. This is the conversation we need to be having. But a lot of people don't have the tools, they don't have the spaces, they don't have the sites of the relationship, right, to really challenge themselves. And when it comes up on the national stage, then it becomes a politicized attack against, one against the other. So what do we say to those people who want to attend to the moment, but or especially to your point, Dr. Puckrein, about politicians, what do we say to those who look at their politicians and say, now I see that you do not, and you cannot, and you will not attend to my health needs and safety. You don't even have the proper tools to grapple with ideas around race and racism. What do we say to those people who need not just be tacit allies, but we need accomplices down in the dirt with us,
I think we need representatives like Congresswoman Kelly, and we need to support her and the legislative agenda. Democracy is it's a contest of ideas. At the heart of it, that's what it is. And we need to make sure that our voices are heard. We got to go vote, even more critical now because some of those folks can't be back in Congress. I'm just telling you, we're gonna have to work very, very hard. But also we have to support her, support the members, and think about the legislative agenda and the policies that have to move forward. I'm looking at the data, right? And I can see inside the Medicare program the disadvantages to minority populations. A whole new set of science about using continuous blood glucose monitors to manage diabetes. And it's very, very difficult for a minority to get one of those CGMs in either the Medicare program or in the Medicaid program. I can give you lots and lots of examples of that where just by the way the policies are designed, they're disadvantaging minority populations. And then they stand back and say, I don't understand why minorities are going to the hospital for cardiac events with diabetes, when of course the system is programmed to do that. And so some of us have got to go dig in the data and pull it out and bring it to the members and bring it to the policy people and show here's what it is. We need to have the community around us because we need all of those voices to make it happen. And then I think the Congresswoman is correct. We also have to make sure that the workforce is diverse and that we have people throughout the system that are concerned and are making sure that when we all, wherever we are, walk in that front door, that the system is really there to help us. I think that's the hard, dirty work of it. And there's no easy pathway here. We didn't get here in an easy way, and it ain't going to be an easy way to get out. And so we have to support these members and make sure that the policies, that they get the information they need about the policies that we need to have in order to build a society that we all can live in.
That is so right on. You know, we don't, as I tell my constituents, I want to hear your voice. I want to hear your ideas. I don't have all the ideas. I don't know, everything. And I think it's so important what Dr. Puckrein said, that, share what is going on. Like, I didn't know that, what you just said about the glucose, and then let's figure out what we could do about it, either legislatively, programmatically, resource wise. Is there something different, that we should be doing? I serve on the subcommittee of healthcare on ENC, so and we actually started Disparities working group. So this is something, that I would bring to the working group, which is made up of all kind of people, to push. Maybe we need another program or more money in a certain place, or we need to pass legislation. But, I tell everybody, yes, you must vote, but after you vote, you still need to pay attention. We so appreciate Reverend Warnock and Mr. Ossoff coming in, but we still need people to, that's not good enough. We still need people to pay attention, making sure they have the information they need, but also another good point, making sure we have the support, because, we go do battle, and it's good to know that the cavalry, is behind us and supporting us, because it is very tough. I've been trying to get maternal mortality, and the issues around that passed, and I have not, done it yet. We came really close, but I'm gonna have to refile again. And the more they hear from people, and the more, again, that we have the cavalry behind us, then whether you live in a red district or not, keep the pressure on those folks. Believe me, people are thinking about things now. They never thought Georgia would happen or Arizona would happen, but it happened.
What I hear you both saying so clearly is, policies change behaviors through incentives, through the law, but it's really the stories, the voices that change hearts and minds. And that's what we're talking about, right? And if the stories, sometimes the stories don't feel good, right? And it goes against what people hold fast to in terms of this is what I stand for. This is, what America stands for. But there's this disassociation oftentimes where we can have story after story after story, and it has, to your point, Congresswoman, the voices have to continuously be raised. The issues have to continuously be pushed, because eventually they, people who are like yourselves in policy spaces and our lawmakers on whom our lives depend in so many ways, something's going to click at some point. We just hope that it's not before we have to lose so many lives or have a siege at the Capitol, because what that also just demonstrates to the entire world is, especially because the dominant narrative of America is, the ultimate dream. It's the pinnacle essentially of what a nation should aspire to be is the dominant narrative here. If that's not the case, then it's very scary to break that story wide open. But we have to, because lives are dependent on it. We have about 15 minutes or so left, and I want to make sure that I'm harkening back to some of the things that you all have already mentioned by bringing up some questions from the audience. I want to go back and talk a little bit about the healthcare workforce and representation, and the both of you please chime in here and just tell us a bit more about recruitment and education, and what are some things that still need to happen in the policy space to ensure that our healthcare system is representative of who is currently in the U.S. and also the needs. And Dr. Puckrein, you talked about segregated healthcare systems. I would like to specifically mention the role of what we call the Hilbertan Act, of 1936, I believe, which was essentially the, it was an investment, the largest investment in hospital building in the nation, for quite some time. But those hospitals that were built were also built on a clause of separate but equal care, right? So let's bring all of that to bear on your answers as well. What do we need to get, to jumpstart accessibility to being a healthcare provider?
So this is a conversation that I was having yesterday, and I hope they don't mind if I use their names, with the Association for Clinicians with the Underserved and with the folks at Centene, and we were talking about what do we need to do to really, diversify our workforce in healthcare. And by the way, healthcare is the largest employer in the country. It's not manufacturing. I know everybody runs around and thinks it's manufacturing, but it's not. It's healthcare. And one of the things, we've all talked about diversity in healthcare for a long time. There's no structure. There's no one accountable to make that diversity happen, right? It's nobody's job who wakes up in the morning and says, I need to be thinking about the diversification of the American workforce. So somehow through policy or whatever, somebody's got to put something in place that does it. Because what's happening right now is that money's out there, right? All of the colleges of medicine, they have a budget to increase diversity in medical school. It just ain't happening, right? It's not working. So there are lots of pots of money that the federal government has put out there, but nobody owns it, right? And so if nobody owns it, it doesn't happen. And so one of the things I would say from a matter of policy, we need to figure out where that ought to reside and who ought to have responsibility for it. And let's see if we can't build structure, because the structure has to start down in elementary school. It's not going to start in college. That's way too late. And so somebody's got to think through all of that. And so I think that would be my answer to the question of diversity, that let's put some structure in there and get a group to take ownership of it, and let's see what happens.
And again, I couldn't agree more. I was going to say we have to start at a much younger grade level, but also the other thing is we have to make sure people have the tools and the resources and the interest, because again, parts of my district, they can't even go online because they don't have the broadband. They don't have, everybody doesn't have an iPad or, a laptop like, some people do in some school districts. So, it is going to take a multifaceted approach to make sure that, we can get the interest at a young age from our boys and girls, that they even want to go in the direction. We see now many job openings because our young folks don't have the technical acumen to go into jobs. You don't even need a college degree, but like advanced manufacturing, you need to have some technical acumen. And if you don't have the foundation, then it's still tough, to get into the discipline. And definitely when you think about healthcare, and I do think, when you see it, you can achieve it. So mentors are really, really important, that people, go back, give back, bring somebody forward. I think that's really, really, important also. I mean, even though I'm not complaining about my career, but when I think about if I had someone I could really talk to about, how much I hated math when I got to geometry, or, like someone that could help me, pull me along. I think that would have, definitely would have helped me, or, I did well in science up to, a certain point. And then, when I worked on my PhD, statistics kicked my butt, and I got through it, finally, but it would have been nice to have, mentors and people helping and pushing.
And I have to say, you are the epitome of a mentor. All of the adopted daughters and sons that you have, and the fact
lots of kids,
the fact that, when I worked for you, I mean, I've been going now 18 months or so, but you are my forever boss. And a lot of it is just because, you know, I love and appreciate you as a person and what you stand for. And for those who don't know, like, you really firmly believe what it is that you do, Congresswoman. That goes a long way in terms of who you are, but in terms of also the policy that you push, you know. So your story is not separate from, and this is not unique to you, but your stories as policymakers are not separated from the work that you do in the halls of Congress. That is quite clear. You know, now we just have to make sure that the people who are in the halls have more stories like yours. Congresswoman, I know that you have to leave in just a couple moments. I'm wondering if you can offer us any final words, and then I'll make sure that that Dr. Puckrein and I can close the conversation strong.
Sure. Even though, you know, it's been a tough year, it has really been a tough year, as you guys know, I lost an uncle to COVID back in May, and then we just lost another family member, my cousin's father-in-law. He was, it was in a lot of papers because he was a Tuskegee Airman, and he died like 3 or 4 days before his 101st birthday. And you might say 101, he could dance. We danced at a wedding 2 years ago. He still jogged. I mean, he was on it, you know. So it was a tough year, you know, all the social injustices, but, you know, I'm an optimist. I could not be in this job if, you know, I wasn't an optimist. And I do feel like, even though we're going through tough times and what happened last week and who knows what's going to happen, you know, at the inauguration, but we have to be focused. And, you know, I do feel like we're coming out of the dark. And, you know, as they say, the darker the storm, maybe the brighter the rainbow, you know, at the end. But we need everybody's help. Again, like I said, if you have ideas, you know, please, you know, share your ideas. Some things that I wanted to know, like people, you're already in the healthcare field. What were your barriers? Like, what do we have to do so that the next person doesn't have the barriers? What are things, you know, loan forgiveness? Is it not fairness and, you know, being accepted into places? You know, share with us, you know, what your barriers and challenges were, even though you've made it now, and how you made it, you know, so that we can make it easier, you know, for the next person. But as I said, I'll be back concentrating on maternal mortality, you know, health, IT, COVID-19, and trying to end racial disparities in every way that I can. But thank you so much. It's always a joy being with the three of you. I know Brandon's hiding, but and I have a wonderful healthcare person, Nicole Varner. I've just been so lucky with my healthcare people, and Megan Thompson, who's my new fellow. So we are all ears. So don't hesitate to call the office, because we're still answering our phone and definitely doing our work. So thank you so much again. Actually, I have an ENC organizational meeting that I need to get to. So take care and thanks again.
Well,
thank you, Congresswoman Kelly.
Be safe, please.
And you be safe
I will.
along the way. Thank you so much.
Bye-bye.
Talking to you soon. Dr. Puckrein, so we've got a couple more minutes, so let's have some more fun. You know, I want to ask you about the business model associated with moving forward with an equity agenda, right? And a lot of times people will argue, you know, well, there's no financial incentive associated with centering equity, you know, within any effort across healthcare, especially those that are already costly, right? So, you know, what is the business argument for equity? Why should we, you know, and what's the business argument for patient-centered healthcare overall, you know?
I really thank you for that question, because it cuts to the heart of everything, right? Because at the end of the day, we are a business community. I laugh, for those Star Trekkers out there, I talk sometimes with us being the Ferenges, right? Because our minds are always so much in business. Probably the most important thing that we can do is to, and I said it earlier, is to center our economy around our biology. because if the business is taking care of ourselves and each other, if that's the prime directive, and we build community, racism will get challenged in its own right, because what everyone will be working on is taking care of their neighbor and themselves. So let's be precise about that. And I'm going to look into the window in the pharmaceutical industry for a moment. So when I started in healthcare, and I used to go to the pharmaceutical folks, they would say that African Americans can't buy my product. And the answer to that was true, because back then 48% of African Americans had no healthcare insurance. 54% of Hispanics had no healthcare insurance. So what's the point of putting them in a clinical trial or anything else? Because at the end of the day, they couldn't, out of their own pockets, because that's what they'd have to pay for, they couldn't buy those medications. So think about that for a second. They couldn't buy them. So one of the things that Obamacare did, it opened up that market, right? And we started to be able to purchase those products. And so now there's an emerging market in pharmaceuticals for minority populations, right? And if you look at the state of California, Texas, Florida, those are majority minority communities. And guess what? If you're going to sell those pharmaceuticals in those communities, you have to make sure they're safe and efficacious, and you have to work with those communities. And sure enough, you begin to see changes within that industry because of that. Same thing is going to go on in healthcare, right? Because the majority of people under the age of 18 are minority, right? And so if you're going to be in the healthcare business, right, that's your constituent. Those are your customers. And so the point I'm making is the demographic shift is creating the equity, right? I mean, we have to push on it, and we have to make sure, because people, the old economy is still there, and people are still trying to do that old stuff, but it's not going to last, right? Literally because of the demographic shift and the need for workforce. So what are you going to have? You're not going to have minorities as physicians and the majority population. You're going to restrict access to jobs. It's not going to happen. And so that's why I'm optimistic about the future, because the business case is being made every day in the demographics. So when we talk to industry, we tell them, are you going to do business in California? Are you going to do business in Texas? Are you going to do business in New York? All of those communities are diverse. And so that's part of also the politics of it, right? People can be upset about it, but the world is in fact changing. And so as we move towards that, I think it's important for our community to describe the healthcare system that we want. It's not that you just have to sit back and let the demographic shift take hold. No, you have to design it and make sure that the system works for each and every one of us. And I think that's where the future is. And I'm comfortable that we'll get there just because of the sheer demographics.
I share your optimism and really appreciate you breaking that down. It really is that, right? Equity, as much as it is an expensive investment in and of itself in terms of money, the payoff is really, the real currency here is time, to your point, and shift. And so, but I don't want to, I don't want to say, use the old adage, just be patient for what's coming. We have a lot of work to do in the interim, Absolutely. Right? And we've got to be able to utilize our resources, leverage our spheres of influence, and challenge the dominant narratives that inform who we are as Americans, as people of color, and those who are accomplices and allies in the fight. So we are at time, Dr. Puckrein. I can talk to you for hours and hours.
I always enjoy talking to you as well. It's always a lot of fun.
A lot of fun indeed. And I thank you and for your continuous passing of the mantle too, and teaching. So thank you so much for what it is that you do, Dr. Puckrein.
Yeah, I'm going to get Brandon next time to send me a bigger memo so I can get my stuff together.
So you can wear your Cap Alpha sign situation. It's all good. He's representing well for you.
Yeah.
Brandon, I pass it back over to you, sir.
Dr. Puckrein's easy. He just exemplifies it, so that he doesn't really have to wear
The epitome of a Kappa man.
Yes, yes. Well, I just want to thank you two, and then again, obviously, Congresswoman Kelly for the conversation today. I also want to thank, Keiko. I always want to behind the scenes, making sure everything happens. Really quick, before we go, I have just two big announcements. One, in addition, we'll always have our Friday webinars that Mia's leading, but next Monday, we talked a bit about the COVID-19 vaccine in Black Americans. So we're going to have a town hall discussion on that. And doing it with us would be the National Urban League, the NAACP, and the Pro Football Hall of Fame will be joining us with a team of experts to have a longer conversation, an hour and a half to 2 hour conversation on Monday, January 25th. So looking forward to that. Mia is actually leading that. So we'll have fun. We'll have fun. We're doing a lot of work to make sure everybody's prepped and prepared. And then Mia alluded to this too, and Dr. Puckrein mentioned it, that we're having our summit the last Monday and Tuesday of April. We're going to be doing it virtually again because we want to be safe. But we want to still inform. And the topic, the theme this year will be racism makes me sick. And so we're looking forward to a very thoughtful conversation, a thoughtful 2.5-day conversation on that. With that, I'll leave everybody to have a good weekend. Happy MLK holiday. Do some service for someone else. Have a good one.
I want to thank Mia and Brandon, Keiko. Great job.
Thank you.
You're doing a wonderful job. Excellent.
Thank you so much. Real quick, you see Brandon in his Kappa hands, right?
As always.
Appreciate you all.
Ashok will send the link as well.
Right.
Thanks.
Thank you.